Hello everyone, welcome to today's session. I am Ashifa, Assistant Professor, Department of Optometry at Yenepoya School of Allied Health Sciences. Today we will discuss about visual acuity assessment in children. So let's start with specific learning objectives. At the end of the session, audience will be able to describe the age-specific visual acuity assessment method, list the key visual milestone during eye development for each age group, explain the visual acuity assessment in various age group in children. So moving to the introduction, visual acuity is ability to see a two object as separate, or it is a resolving power of eye. Then visual acuity is defined as smallest object that can be recognized at a certain distance. In visual acuity testing, we ask to patient read a smallest letter they can able to see in a visual acuity chart at a particular distance, that is 6 meter or 20 feet. So now why visual acuity assessment is important in children? So it helps to early detection of amblyopia, refractive error, strabismus and other ocular pathology, help in ensuring normal visual development, which is important for learning and overall well-being. And also it helps to identify issues that may interfere with academic performance or cause developmental delay. Next, we are moving into challenges. What all are the challenges we facing in assessing visual acuity in children? First thing is limited ability to understand the instructions. Second thing is short attention span. Third thing is variation in cognitive development, affect test reliability, and last one is need to child friendly and age appropriate test methods. So just going through the what all are the visual acuity milestone according to the age. At the age of 29 week of gestation, which means just before the birth, the pupillary reaction will start. It means they get a visual system being functioning. At the age of 5 years, stereopsis is well developed, which means they get a good 3D image or 3D vision. So let's move into the how visual acuity assessment for varies across the different age group. So let's start with a youngest age group, that is birth to 3 months. So these all are the specific tests we have to doing in this age group. First one is blink reflex test, pupillary light reflex, vestibulocular reflex, eye popping test, optokinetic nystagmus test, and visual evoked response. Let's go through one by one. So first thing is blink reflex test. Blink reflex is present since birth, which means soon after the birth. When bright light is shown, a normal infant should respond by blinking. Next test is pupillary light reflex test. It is actually what we assessing here is the pathway between eye and brain are working properly or functioning properly is assessing here. So pupillary reflex present in premature infant from 29 to 31 week of gestational age. Then best performed in semi-dark room for optimal response. Infant pupils are smaller and constricted in bright light as shown in the figure. In bright light, pupil should be constricted, but in dim light, pupil will be dilated. So lights used should be small, round and bright to see a clear constricted pupil. So moving to the next test, it is vestibulo-ocular reflex. In this test, we observing for doll's eye response, which means suppose if baby's head is turned right side, eye is move on left side, and vice versa. That is head turn on left side, eye is move on right side. It is doll's eye response. So moving to the next test, it is eye popping test. So it is a unique behavior in very young infant, ability to detect changes in room illumination. Test procedure is when room light are dimmed, the baby's upper eyelid pop open wide. Eye may closed when the lights are brightened, but pop open again when light are dimmed. So next test is optokinetic nystagmus test. This is also very important test in this age group child. So here optokinetic nystagmus test is a objective assessment mostly used in infant, incorporated children and infants. Here we mostly used in a optokinetic nystagmus drum. It consists of a black and white stripes or pattern. So Here we are noticed in two key phases, that is slow phases and fast phases. Slow phases means when the drum is rotating, eye also moving in the same direction of the rotating drum, and suddenly I jumped back, which means the drum is rotating reverse direction. Here actually involuntary eye movement is occur. So optokinetic nystagmus acuity in newborn 6/120, which means it is poor acuity, and 6/60 at 2 months, 6/30 at 6 months, 6/6/20 to 30 months. Next, moving to the visual evoked response, it is also very important test in this age group. So it is also objective assessment, mostly used in infants and uncooperated child. So it is an encephalographic recording from the occipital lobe in response to visual stimuli, assess the functional state of visual system beyond the retinal ganglion cell. So here in visual evoked response, we give a pattern. There is two stimuli, that is flash stimuli and pattern stimuli. Flash VER, which means flash visual evoked response, is very young, used in very young children and those unable to fixate, assess the integrity of macula and visual pathway. But in pattern reversal VER, it is provide a rough estimation of the visual acuity. It is like checkerboard pattern. It is the pattern reversal VER. Next is moving into assessment of visual acuity from 3 to 6 months. In this time period, child is ability to get a fixation development, or they started to fixate the moving object. So they, in addition to above mentioned test, these tests are very useful. Tests such as fixation behavior test, Brigner's red reflex test, Manet's reflex test, and cover test. So let's go through one by one. So moving to the first test, it is fixation behavior test. It is assessing the child's ability to fix and follow a face, toy, or interesting object. So this test is conducting binocularly and monocularly. In this figure, see, we can able to see if the doctor is occluding baby's one eye, the baby is quite happy. But in figure B, we can clearly see that doctor is occluding baby's one eye, the baby is trying to remove that hand, which means the occluding eye is good eye and the other eye there is a poor visual acuity. So next, moving to the central study maintained method. This is also very most common test in this age group child. So central is asked to infant to fixate on a pen light. Examiner check the corneal light reflex. Study means use a small target, which means there is any interesting object, we move in front of the child. Nystagmus or oscillation indicate unsteady fixation. Maintained, it is ability to keep the eye fixed when either eye is covered. Next, moving to the Brigner's red reflex test. In this test, we use ophthalmoscope and ensure that this procedure is done in dim illumination room, and it is help to detecting strabismus, especially in uncooperative children. And in this test, we compare the red reflex from the both eye. If the reflex is same in both eye, which means the baby is normal. There is any asymmetrical reflex is occur, which means there is any problem or any abnormality in baby's eye. So let's move into the cover test. Cover test also performed in an infant aged 3 to 6 months or older. So normal eye, both eye focused on a object, no movement when one eye is covered. It is shown as a figure. In second figure, we have clearly see that one eye is occluding, that time other eye have no movement. The other eye is still focusing on object, which means it is normal eye or normal vision. There is no strabismus is present. But in first picture, we can able to see if suppose we occlude the one eye, the other eye is move inward or outward, which means there is a strabismus is present. It is esotropia or exotropia. It is move inward. It is called as a eye is move inward when straight eye is covered, it is called exotropia. Eye moves outward when straight eye is covered, it is called as esotropia. Now let's look into the assessment of visual acuity from 6 to 12 months. In this month, the preferential looking test and CAD4 drum test are most important test. So let's go through one by one. Then preferential looking test. These tests are based on the principle that infants' attention is more attracted by patterned stimulus as compared to a homogeneous surface. Hence, if infants is given a choice between a pattern and a plain surface, the infant preferred toward the patterned surface, which means here examiner gave a target, patterned and a plain surface, and there is a central hole in that target. The examiner should observe the baby's eye through that small hole. If the babies are looking the patterned or striped pattern, it means the baby have normal vision. If the baby can't able to focus on that pattern, it means there is any visual abnormalities. Moving into the teller acuity card test, a common preferential looking test modification is used in clinical practice. Recommended for infant 1 month to 1 year old to assess visual acuity. Test distance varies with the age. 36 cm for infants, 54 cm for children up to 3 years, and 84 cm for adults. So this is the teller acuity card. It consists of black and white pattern, and there are 70 cards, and this size will be reduced in each card. So what we are assessing here is baby can or child how well they can find the fine stripes or pattern in this card. So visual acuity rapidly increases from 1 cycle per degree at 1 month to 40 cycle per degree by 5 years. So next, moving to the CAD4 drum test. And this test purpose is a detection acuity test for infants and children under 2 years. Test performed at 60 cm from the child, and the child observed the oscillation drum with black dot of varying size as shown in the figure. Now we are looking into the assessment of visual acuity from 1 to 3 years. In this age group, a child can able to visually differentiate the object. So in the above mentioned test, these tests are most helpful in this age group child. So tests are Cardiff Acuity card test, marble game test, Sheridan's bowl test, Worth ivory bowl test, dot visual acuity test, coin test, and miniature toy test. Let's go through one by one. First one is Cardiff Acuity card test. It is also known as a vanishing optotype test. So designed to measure visual acuity in children aged 1 to 3 years. It is used line drawing of familiar object presented against a grey background. So procedure is the test is conducted at 2 calibrated distance, and total of 11 set of card are available. Each set feature optotype corresponding to visual acuity range from 20 by 400 to 20 by 20, that is 6 by 6. So next, moving to the marble game test. It is very interesting according to children. So this focuses on comparing the visual function between the two eyes. Child places marbles into hole or box with one eye covered at a time. The vision of an eye is then noted as being useful or less useful, which means the child is performed well or they are performed successfully, which means the vision is useful. If can't able to do this procedure well, which means less useful. So let's go through Sheridan's ball test. Use a series of styrofoam ball in progressively smaller size. Place the infant at a distance of 10 feet from the ball. Roll each ball on a white or grey background. Ask the child to fixate, follow and pick up the ball. Record the smallest ball child can track and respond to. Next, moving into the miniature toy test. Miniature toy test also very interesting according to child. So goal of this test is assessing the child's ability to recognize and differentiate toys from a distance, providing a rough estimate of visual acuity. Material use a set of miniature toy. The child is positioned 10 feet away and asked to name or pick the pair from the assortment. So let's moving into the measurement of visual acuity in preschool children, that is 3 to 5 years. In this age group, children have better to identify the object, letters, and they are verbalized and recognized well. So in the addition to above mentioned test, These all are the test is very useful. Tests are Landau's C test, broken wheel test, illiterate cutout test, and a pictorial vision chart. So let's go through one by one. First one is Landau's C test. To assessing minimum separable acuity and young children who understand the concept of a break circle, and circle C with a break at one of four positions, that is 3, 6, 9 or 12 o'clock, and child identify the position of break up, down, left and right. So next test is broken wheel test. It is also a subjective visual acuity assessment for toddlers and preschool who are unable to perform matching task. A pair of car with progressively smaller size is shown. So one car has a broken wheel. So here card set is 7 pair of card equivalent to visual acuity from 20 by 20 to 20 by 100, designed for use at a 10 feet and forced choice to paradigm without a verbal response. The test procedure is the examiner hold up one pair of card at a time. The child point to car with the broken wheel. The child must score 4 by 4 to progress to smaller card size. Next is illiterate e-cutout test, suitable for children aged 2.5 to 3 years. The procedure is child is given a cutout of the letter E, asked to match it with isolated E of varying size as shown in the figure. Next is pictorial vision chart. It is used when a child can verbalize showing familiar pictures rather than the symbol. The popular tests are K picture, Lie symbol, Allen card test. These all are the pictorial vision charts. So let's move into the summary. Visual acuity assessment for children from birth to 3 years require age-specific reflex and test. From birth to 3 months, visual response like the blink reflex, pupillary late reflex, and vestibulocular reflex are observed with tests such as optokinetic nystagmus and visual evoked response. Between 3 to 6 months, tests like Cadford card, the marble game, Sheridan's ball, and Wood's ivory ball are used along with the reflex such as Menace and cover test. From 6 to 12 months, the Cadford drum and preferential looking technique are applied. For children aged 1 to 3 years, tests like Cardiff card, word ball, dot visual acuity, coin test, and miniature toy task are used to evaluate their visual acuity development. So these all are my reference. Thank you.